Thank you for joining the Senate Finance Committee. This is Thursday, March 6th, voting list number 10, and we're going to start with Nathan's bills, Senate Bill 60.
Thank you, Madam Chair. First, Senate Bill 60, as amended and shown in the reprint before you on page 3, requires an insurer, a nonprofit health service plan, and a health maintenance organization, as well as Medicaid, to cover calcium score testing in accordance with the most recent guidelines issued by the American College of Cardiology that expand the scope of preventative care services for the benefit of consumers. Also of note, the bill takes effect January 1, 2026 and applies to policies issued on or after that date. So the amendments alter the standard under which an insurer or Medicaid is required to cover calcium score testing, as I've described. Both Medicaid and the insurers are on board, and identical amendments are advancing in the House.
Very good. So do I have a motion for the amended bill, Senate Bill 60?
Move favorable.
Thank you, my vice chair, and second, Senator Jackson. All in favor of the amended bill, Senate Bill 60? Do I have a unanimous vote? Unanimous, thank you.
Up next is Senate Bill 229, for which you do not have a reprint because there are no amendments. This is a departmental bill that repeals the June 30th, 2025 termination date on the formula used by the HSCRC to determine the maximum amount of user fees that may be assessed to support the Commission's activities. There are no amendments.
Senator Gallo, do I have a second?
Second.
Thank you, Senator Hayes. Senator Lam, you have a question?
Yeah, just a question.
Okay.
Has everything been worked out with MHA on this? Or?
Yes.
Okay. Just for, I don't see anyone from the HSCRC here, but would be helpful for someone from the HSCRC just to get back to us on update on some of the things that came up during the briefing earlier.
I can talk to you about some of those. I've been in meetings every week.
Great.
Thank you.
Thanks.
And I have a message from Maryland MHA that they're fine with it now. So Senate Bill 229 without an amendment. I have a motion and a second. All in favor of Senate Bill 229? Unanimous vote. Thank you.
Up next is Senate Bill 379, which, as introduced, repealed the exam requirements at the bachelor and master's social worker license levels. But as amended and beginning on page 4 of the reprint before you, the bill extends the termination date of the work group on social worker requirements for licensure, and then requires the work group to report on modifications to the licensing exam, the implementation of additional accommodations for test takers, the availability of exam preparation materials, and then in the context of those changes, report on the continuation of the use of the licensing exam for bachelor and master's social worker licensees. So the amendments to the bill strike the bill as introduced and implement the provisions I described.
Senator Hershey?
Thank you, Madam Chair. I'm certainly not opposing it going to a work group. But as you know, I look at the work groups and make sure that I'm not on them. This one I'm clearly not, but it does say one member of the Senate of Maryland who is a member of the Legislative Black Caucus appointed by the President of the Senate. I'm just wondering, have we designated caucuses before in appointing work groups?
I believe, and Nathan will correct me, in the original work group, it was designated that way.
Yes.
Because it is an issue with the minority exam
I
not
understand, but
passing the
there's
exam.
also a Democrat caucus and a Republican caucus as well. I'm just wondering if we've
Yeah.
been designated
You know,
caucuses
typically we'll
before.
say 2 senators and 2
That
delegates
usually means
because we do one of
party.
each.
Okay.
But I think because this is a sensitive issue and it really affects minorities.
It's good. I knew you'd have
All
the
right,
right
thank
answer. Thank you very much.
Senator Washington, the other Senator Washington.
Yeah, this isn't my bill. Yeah, you mentioned it earlier, actually, in your rebuttal to Senator Hershey, which was, there was an initial work group that made this recommendation, and so we're having another work group
We are.
to determine what exactly.
There are changes coming for the exam, which wasn't discussed in the work group at that point, but they've sent us a document, an official document, that says they're going to change the number of multiple choice questions from 4 choices to 3. They're going to allow people to retake the parts they missed without retaking the entire exam, and they're going to provide study materials. So we want to see if this helps the passing rate. Many of us that have talked about the bill were not comfortable with this being the only profession that doesn't pass an exam, a professional group that doesn't pass an exam, and we felt that we just want to give it one more try to see if these changes to the exam help more people to pass it.
So the work group is determining the number of assessments they can take, or the decrease in assessments that they can
They're
take.
going to determine if the passing rate on the exam is improved by these changes, and if not, come back with a recommendation probably again to not. There were so many complications with social workers not being licensed. We heard from the Office of Public Defender, they wouldn't hire someone who didn't pass by exam. We heard that there are a lot of job openings for people that haven't taken the exam or haven't passed the exam.
Right.
So we just felt like it wasn't a good message to say our social workers don't pass exams. So hopefully this is going to change that passing rate.
Got it. Okay. Thank you, Madam Chair.
Thank you. Senator Mounts?
Oh, thank you, Madam Chair. Real quick, in the ideas that were shared with you, was there any discussion about shorting the time frame before taking the exam? You said there were some changes to the exam coming, and I was just wondering, because that 90 days, I don't know, I thought I'd just bring it up while we're discussing what.
What were the 90 days, Senator? I don't recall that.
And if you fail the exam, you have to wait 90 days before you take it again.
Is that in any of the, that would be the ASWB that would make that decision. That wouldn't be us.
I'm not applying to serve on the work group. I was just wanting to bring that up.
Me
so.
either.
Okay. Just,
Is that anything in the?
In the materials that I'm looking at now, they're forecasting the changes that are to come. I don't see anything about the frequency with which the exam is administered or time between the taking of the exams.
let me know. That's,
And everybody agrees to this, all the partners.
No, not everybody agrees to this because you can't make everybody happy. That's good legislation when you don't make everybody happy. No, the sponsor would rather us pass that they don't need they don't need an exam to be licensed, but I think the majority of us majority of members that have talked to me were not happy with that choice. So we have an amended bill. Do I have a motion on the amended bill? Senator Jackson, do I have a second? Senator Mount, second. All in favor of Senate Bill 379 as amended? Are you okay? Unanimous vote.
Okay, next on the list is Senate Bill 981, for which you do have a reprint. This bill alters hospital financial assistance and collection of debt policies, including requiring a hospital to reduce a patient's out-of-pocket expenses for medically necessary care by a specified percentage based on the patient's family income. The bill prohibits a hospital from filing a civil action to collect debt against a patient under certain circumstances and increases the number of days from 180 to 240 before interest payments on medical debt may be assessed or a hospital is authorized to take civil action to collect a debt. The bill alters the notice requirements for hospital financial assistance policies and alters the monthly payment amounts for an income-based payment plan for medical debt. So the amendments, which I'll go over quickly, provide that a contract, this provision is on the unnumbered page 2 of the reprint, that a contract, including a contract under seal, that is related to an obligation of a consumer to pay consumer debt that arises from hospital services between a consumer and the hospital, is not subject to the 12-year statute of limitations provided under current law on certain actions. On page 6, you'll see that the amendments require a hospital to obtain documentation ensuring the patient acknowledges receipt of notice of the hospital's financial assistance policy before discharge. And then finally, the amendments strike language that would have authorized a hospital to include a professional fee in its debt collection policy. That changes on page 12. I will note that after gathering some information, I'm told that the bill has no impact on uncompensated care or hospital rates. I'm told that the Hospital Association is on board and that these amendments align the bill with the cross-file that is advancing in the House. Past third reader. Thank you for the update.
Senator Lamb?
So a question for the sponsor, is SEIU still okay with all these changes?
Everybody is okay with this now. Thank you.
Okay.
Can I just request amendment adding myself as a co-sponsor, please, Madam Chair?
I'm sorry.
Can I just request amendment adding myself as a co-sponsor, please?
Sure.
Thank you.
Thank you. Does anybody else want to be added as a sponsor on this good financial assistance bill?
Can you give me those who don't?
And anyone that doesn't want to be added from the committee? Okay, it's committee amendment. Follow on. Thank you, Senator Guile.
And that's it for me.
David's going to. You move favorable. Who seconded? Senator Jackson seconded. All in favor of the amended bill with the pile-on amendment, Senate Bill 981. You okay?
Yeah.
All right. Passed unanimously. Thank you, Senator.
Okay, if you go to the top of the page, there's two bills up there that have my name near it. The first bill is Senate Bill 374. This bill provides cancer screening coverage to firefighters in the state.
Move favorable.
There's amendments.
That's amended.
The chair worked closely with Amber on this bill all session, so you have a series of amendments offered by the chair. If you go to page, the bill made it a mandated benefit. That's all struck because you know how that all sometimes goes. If you go to page 3 of the reprint in front of you, you'll see that there's changes. There's language added to the local government article that would apply to the counties. And it would say it mandates if the counties who are self-insured, it would mandate that they provide cancer screening in accordance with the latest cancer screening guidelines of the IAFF. But there's an out allowed. Also, firefighters can't be charged with deductibles or coinsurance. The county may, instead of providing this if they are self-insured, provide a no-cost annual examination of firefighters employed by the county that includes preventive cancer screening, or they may apply for a grant under Title 13, Subtitle 40 of the Health General article to pay for innovative cancer screening technologies, including a multi-cancer early detection blood test. Further on in the bill, there's uncodified language added that requires counties to collect data and report this data to the Maryland Healthcare Commission, who then must conduct a mandated benefit study.
Do I move favorable again?
You have a question, Senator Washington?
Quick one. I know there's some added amendments. Well, first off, thank you for the bill, Madam Chair. It sounds like a really great bill. I just wonder now the amendments have been added, what's the changes to the fiscal note on the bill?
It allows for the counties that are already doing, the self-insured counties already do physicals for their firefighters. So it adds a few more, just really a few more exam kind of things. But as I said, if they felt like that created a physical responsibility, they can apply for this grant that we have as a result of a bill that Senator Gazzoni passed. And they do a blood test. So either way, they should pick up, early signs of cancer.
So if
And then
there's
I
a-
want to see if it really helps. That's why we have the study added, so we can see if they have some early signs and maybe help people heal more quickly.
Got it. Okay.
So we've worked with the counties with MACO, and I think everybody's on board.
Okay, good.
Any other questions? Can I have a motion?
I think you have one.
I had already moved favorable.
Oh, I didn't hear you, Senator. Senator Kramer moved favor on the amended Bill 374. Do I have a second? Senator Washington? Okay, thank you. All in favor of Senate Bill 374 as amended? Unanimous vote, thank you.
Okay. The next bill on your list is another Senator Hershey bill. And this is Senate Bill 773. The bill requires administrators, carriers, and PBMs to include payments made by an enrollee such as copay assistance when calculating cost sharing. It also requires administrators, carriers, and PBMs it says that they may not set, alter, or implement or condition healthcare coverage based on the information about financial or product assistance for a prescription drug. You have a reprint in front of you with some amendments offered. Some of these amendments are technical amendments offered by the Maryland Insurance Administration, and then there's an amendment offered by the sponsor on the bill. So if you go to page 3 of 5 of the reprint at the top, it's standardized. It adds a standard definition for carrier that is throughout the code and takes out the MCOs. So that's the top page. And if you go to the next page, on page 4 of 5, there's another technical amendment offered by MIA. The language that was in the bill is introduced, and it's in 2 places. It could require a case-by-case determinations based on the requirements of the bill. This would apply standard high deductible plan exemption language to the bill in 2 places. Lines 10 through 14 are struck from the bill because the MIA said they're not necessary. They deal when language concerns a specific service, but not something like this. In the middle of the page, you'll see language added, and this is added in 2 places also. It's added in this part of the code and the code part of the article that deals with PBMs. This is from the sponsor, and it adds transparency from an entity that provide financial assistance. With these amendments, the bill becomes quite close to the bill that's in the House, but there still is a difference on relating. The biggest difference is on pages 15, on lines 15 through 19 on page 4, and the same language is on page 5. These are the biggest difference now between the House bill and the Senate bill.
Any questions? Motion for the amended bill 773. Who was that? Senator Reedy, who's the second? Senator Hershey, second. All in favor of Senate Bill 773? Okay, looks like unanimous vote, but we need to check with Senator Hayes when he comes back. David, where's that? Are you done? Okay, thumbs up. Amber, you're up. I lost my pen.
Okay, so on the back side of the voting list, you'll see my name next to a whole bunch of bills. And we're going to start with Senate Bill 49, which as amended establishes a regulatory framework to govern automatic renewals between a consumer and a seller in which a paid subscription or purchasing agreement is automatically renewed for a subsequent term and requires that the seller allow a consumer to terminate an automatic renewal in a simple, cost-effective, and widely available mechanism. The bill does not apply to certain entities that are already subject to regulation by specified federal or state entities. And a violation of the bill is an unfair, abusive, or deceptive trade practice under the Maryland Consumer Protection Act. And violators are generally subject to the civil provisions, but not subject to a private right of action for damages or the criminal penalty provisions under MCPA. You have a reprint that we can go through. There are several amendments offered by the bill sponsor beginning at page 2. The first amendment generally corrects a drafting error that accurately reflects the bill's intent. There is a parallel amendment at page 5 dealing with this definition as well. On page 3, we have an amendment altering language regarding the termination mechanism and some clarifying amendments that are identical to those adopted in the House. Page 4. There is an explicit authorization for a business to authenticate an account and establishes guardrails for consumers who are unwilling or unable to do so. Next amendment down around line 6 eliminates the toll-free requirement, which was also adopted in the House. Down to line 18 through 22 There's an amendment offered by Senator Mounts as negotiated with the bill sponsor that limits application to free gifts or trials lasting more than 14 days. And there's a parallel amendment to that at the top of the next page. At line 9 on page 5 of the reprint, or sorry, not line 17 on page 5 of the reprint, this is the parallel amendment to the definition on page 2. This is where, with an initial definite term of more than 1 month, is meant to apply to these charging of the credit cards consumer and just with automatic renewal offers. Amendments down between lines 18 to 20 outlines the conditions that must be met before automatically charging a consumer's credit card. Those were also adopted in the House. At line 22, there are additional licensees that are deemed to be in compliance with the bill if complying with certain contract renewal procedures. Down, starting after line 26, there's additional regulated services that are excluded from the act. Both of those last two amendments were also adopted in the House. And at line 31, that's where you'll see that the private right of action and the criminal enforcement penalty mechanisms are being removed from the bill. And to make that amply clear, you also have subsection H saying that there's no private right of action authorized under this section. And further down in the last line of the bill, the effective date is delayed until June 1st, 2026.
Senator Reedy, you have a question? I can't imagine.
Can you repeat all that? No, I'm kidding. No.
It is all written on your reprint.
No, I know. It's outstanding, actually. This is perhaps, no offense to any other analyst in the room, this is outstanding to have the written here. It does help to line by line. Let me work backwards, if it's okay. We removed the private right of action. Is the amendment where we strike 13 on page 5, line 31, we strike 13408 and say 13408 and 13411. I assume that 13411 is the criminal.
That's correct, Senator Reedy.
What is 13408?
13408 is where, in the MCPA, where they also authorize an action for damages. So we're excluding
getting rid of that.
But then
we
in
don't have
subsection
that.
H, we make it doubly clear that there's no private right of
It already wasn't, but we're making it double clear. You and I had a discussion, and I think we had some discussion internally on civil actions. There's still a civil
There's
ability.
still a civil penalty provision that's under 13410 of the Maryland Consumer Protection Act.
And as you and I discussed, but I wanted to be sure I asked so we can clarify here on the record, there was a concern about somebody, a business making a mistake. Perhaps the example I'm going to use, it doesn't even apply anymore with some of the other amendments, but sending the email out at the wrong time and then being subject to up to $10,000 per occurrence in penalties. It's not per occurrence, right? But can you just clarify, what's the step up level of penalties if a business does this like one time and then doesn't ever do it again once they get a warning? I mean, can you just talk through that real quick?
Sure. So under section 13402 of the Consumer Protection Act, there is the division determines that there are reasonable grounds to believe there's a violation. It shall attempt to conciliate the matter by methods of conference and persuasion with all interested parties. So that's where they start.
And that means
sorry.
No,
that's
go ahead.
Unless the violations that are occurring are causing immediate, substantial, and irreparable injury. So as long as those things aren't happening, they have to first try to conciliate the matter. If we get past that and they're determined that there's a violation that should be subject to some kind of fine, the Consumer Protection must consider the following things in setting the amount of the penalty imposed. So that's if we get to the penalty. There's these
So
other
they-
steps
They
beforehand.
start with, the Consumer Protection Division starts with,
The conciliation.
well, constituent, did you tell them that this was a mistake? Have you gone through their process?
Correct.
And then if they have, and there's kind of an impasse or the company's not been responsive, then they could start to consider some sort of fine or
Correct.
action, but they have to consider all the things you just mentioned.
The severity of the violation, the good faith of the violator, history of prior violations, whether the amount of the
Great.
penalty will achieve the desired deterrent purpose, and whether the issuance of a cease and desist order,
Would be-
including restitution, would be sufficient
Yeah,
as
because
opposed.
a lot of times that's where we would end up if there was enforcement, is there'd be a cease and desist and then refund their money or whatever. So then also, who gets the fine? Is it clear it's clear in the Consumer Protection Division article that it's the business that gets the fine? It's not like the employee that sent the email or did the wrong thing. It's the business that's fined, correct?
Correct. So under 13410, civil penalties apply to a merchant who engages in a violation.
Okay, great. I really appreciate you answering the questions on that because there was a lot of different business community folks that had reached out to me about it, so I just wanted to clarify. Can I ask on, going back up, we've got the amendment in the House, these services regulated by the PSC, the FCC, or the FEC, or the FERC. What is that? Is that like power companies and this isn't going to be subject to those, they're not going to be subject to this?
Exactly. Pretty much utility services are not subject to the act.
Because they're not doing a free trial for 30 days.
Right. I
Generally.
mean, generally not. They do have bills that you pay automatically, but that's not what this,
This doesn't
Bills
go after
intended.
auto bill pay because if
Correct.
you're getting a service, you may have auto pay and all that. And there's a different process for appealing if you think you've been defrauded by your power company.
correct.
Does this do anything to stop power lines? I'm kidding. Okay. All right. Okay. And then what is the effect of Senator Moutz's amendments exactly? Like it limits the scope here?
Correct.
I think they're good
So-
amendments, but I want to be sure I know why they're so good.
Correct. So, it limits the application. So, unless the free gift or trial lasts more than 14 days, they wouldn't have to provide, these notices of, before the end of the automatic renewal. So if you're, say, the free trial is for 3 days, you don't have to send these myriad number of notices out to the consumer
Oh,
reminding them
if the
to
trial is
cancel.
shorter than the period of time in the bill,
Correct.
obviously, and some things are 3 or 4 day trials. And then last question, and thank you, Madam Chair, but I thought it was important to go through this so I can understand it, because I'm a little slow. How different is this bill now than the House? They just passed it, and so I'm just trying to understand if there's significant difference. I know we added some of their amendments, but
Yes, there are significant differences between the version here and the House version. Senator, the sponsor, has worked with stakeholders longer because we had more time after the bill was held and things, so
That's
we
great.
added some additional.
there was some
amendments based on
opposition
that.
from one side of the aisle in the House. We're just trying to understand if maybe there was something we were missing that we didn't catch. I think we've probably massaged this bill and really had great cooperation, which we often do in the Senate. So thank you very much.
I was going to say, isn't that so? Thank you, Senator Reedy.
Can I just a quick question. And I know there were some questions earlier about the click to cancel parts on it. And is that what we're addressing in page 3 of the amendments and altering that language? Do you recall?
Yes, so it just altering the language from simple, cost-effective, and widely available to cost-effective, timely, and easy to use. And that is language that I believe did make it onto the House version of the bill.
Did?
The cost-effective, timely. Okay.
Thank you, both.
Is that it?
Yes, ma'am.
So I have a motion, and I don't. All parts at rest. All right, move favorable as amended.
Second, and Senator Reedy, second. All in favor of amended Senate Bill 49? Senator Gile, you bring the hardest bills.
Good work.
Thank you. Good work to you, any.
So for working with me on my amendment, because originally it was a no, and then she worked on that for me and helped us get that on there, so thank you.
After, okay, all right,
And how we were wavering on that one amendment,
sure.
and we're gonna get that cleared up for good.
Next, we have Senate Bill 305. Okay, so generally, this bill establishes a regulatory framework for virtual currency kiosk operators in the state. A virtual currency kiosk is a standalone automated machine through which a consumer may use cash or a credit card or a debit card to purchase virtual currency such as Bitcoin. Beginning on January 1st, 2026, an operator must register each of its virtual currency kiosks with the Commissioner of Financial Regulation, including the location of the kiosk, and display certain disclosures, which we'll go through in the reprint that you have for this bill as well. There are several amendments offered by the bill sponsor after consultation with several stakeholders. We begin at page 2. So here we have new definitions. We're defining a new user and distinguishing them from an experienced user, which are relevant to an amendment at page 5. So we'll revisit that. At page 5, we're asking the Commissioner of Financial Regulation to promulgate regulations regarding appropriate signage to clearly identify a kiosk as a virtual currency kiosk. Down at line 10, this is where we're using the definition of a new user versus an experienced user, and it relates to the daily transaction limits. For a new user who is anyone that's using for the first time or transacting anytime in the 72 hours immediately following the person's first transaction, their daily transaction limit is going to be at $2,000. And then after that time, for an experienced user, the daily limit is $10,500, which is a sufficient amount to generate a currency transaction report. So that's why we landed at the $10,500. Down below line 15, there's a requirement, this was an amendment requested by AARP, that any fee imposed on a transaction that is verified as fraudulent in a manner established by the Commissioner through regulation shall be refunded. Down at the bottom of the page, there's an amendment requiring a receipt to either be displayed on the screen, or if the machine has printing capabilities, because we understand not all do, that it could be dispensed. So that there's some flexibility on that. Page 7, if you look at my numbers on the bottom, page 7, additional disclosure as requested by AARP after line 23. So this is just ensuring that the current exchange rates for each type of virtual currency that are being sold or that can be sold or purchased at the kiosk are being displayed. And down after line 29, they're requiring warnings to the disclosures that we have here under subsection B. We're asking the Commissioner to adopt regulations establishing a minimum amount of time that each disclosure must remain on the screen before advancing. If you're anything like me, I just click next, 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 next. This prevents people from doing that and actually gives them the time to review what the disclosure is. There's another amendment as requested by ARP for live customer service. So we're requiring that an operator maintain live customer service support that is reachable by telephone and available Monday through Friday from 8 to 6. And the next section that we added requires that a virtual currency kiosk operates solely for the purpose of virtual currency kiosk and does not operate as an automated teller machine or an ATM as defined under the same article. This addresses ATMs that also offer virtual currency services that it's become kind of confusing for users of whether they're using an ATM or they're getting virtual currency services. So this kind of alleviates that concern from some stakeholders that we've received. And finally, on page 9, there's just at line 13, changing the may to shall, as we've added by amendment some places where we'd really like the commissioner to be making the determinations about certain things we didn't feel we had the expertise to do. So just requiring that they do adopt those regulations.
And the commissioner's agreed to that. He doesn't have a problem.
He is in favor of this bill, yes.
Talk about a learning experience. We just found out this week that the machine that you heard our person testify actually said ATM on the machine. Some of these Bitcoin operators just upload software, and so we're putting an end to that, among other things. So, can I have a motion? Any questions? Motion for the, Senator Reedy.
Yes, so there was some opposition, I mean, you know, from folks who do Bitcoin and some groups. Did amendments address some of their concerns? Yes. We're good.
They got 3 of the 4,
sure.
and I said, you can't have everything.
No, I understand, but there was like some concerns about some of the limits or something, so.
We did work on those limits, so you
That's
see
great.
them adjusted upwards a little
The
bit.
amount seemed fine to me, similar to regular banking, so that's fine. Okay, just making sure. Thank you very much. It's it's an interesting group of people that it's a diverse mix of
We're not
folks
trying to,
involved.
inhibit people from buying Bitcoin. It's
Right.
the people that are fraudulently,
Yeah.
they don't know they're buying Bitcoin. So, anyway, on the bills amended, do I have a motion on Senate Bill 305? Thank you, Senator Gall. Do I have a second?
Second.
Senator Gall and Senator Kramer, all in favor of the amended Bill 305? Unanimous, thank you.
Okay, next we are going to go to Senate Bill 357, the Prescription Drug Affordability Board Upper Payment Limits Bill. So Senate Bill 355 generally repeals existing reporting requirements for PDAB regarding upper payment limits. Instead, PDAB must determine whether it is in the best interest of the state to set upper payments for purchases and payer reimbursements of prescription drug products in the state that in the board's determination have led or will lead to an affordability challenge in the state. There's a number of things that PDAB must consider when making that determination. And then if that determination has been made, it must establish a process in consultation with the stakeholder council and set upper payment limits in accordance with the established process. The bill generally takes effect October 1st, 2025. However, Section 2 of the bill requires PDAB to set upper payment limits for all for purchases and payer reimbursements that are not specifically excluded in the bill of prescription drug products in the state. If the board establishes a process, it's contingent on other actions. Specifically, PDAB must set upper payment limits on 2 prescription drugs in accordance with the action plan approved by the Legislative Policy Committee, and each upper payment limit must be in effect for 1 year. Within 5 days of these conditions being met, PDAB must notify the Department of Legislative Services, and if DLS receives this notice by September 30th, 2030, the provision takes effect on that date, but if notice is not received by that date, the provision terminates. There are a number of amendments to this bill as well, so you have a reprint. Starting at page 3, you'll see a lot of text has been added. This is just addressing the stakeholder council, adding 3 additional representatives to the stakeholder council. 1 representative of the rare disease community will be appointed by the Speaker of the House. 1 representative of oncologists will be appointed by the President of the Senate. And 1 representative of a patient advocacy organization will be appointed by the governor. Next on page 5, there is some extensive inclusions to the annual report that is submitted by PDAB once an upper payment limit has been in effect for 1 year. So they set an upper payment limit, it's in effect for 1 year. The annual report that is due immediately following that 1 year has to include a number of things, and this is just to make sure that the upper payment limit is having the intended effect and not an unintended effect. So they're reporting on patient out-of-pocket costs, health insurance premiums, pharmacies, patient access to prescription drug products, provider-administered medications that may be subject to an upper payment limit. So a number of things that they're going to report on. This isn't in every annual report. It's only for any new upper payment limit that is set, and then once it's been in effect for 1 year. On page 6, there's a new subsection E. This has to do with the report as well. And it's just ensuring the board can actually get the information it's going to need in order to complete the report. So it's requiring the entities to make a good faith effort to provide any information they request. Down after line 29 on page 6, there is an amendment requiring PDAB to consider the impact of any upper payment limits on patients with rare diseases. And moving on to page 10, the amendments here after line 12 addresses MDH concerns related to potential conflicts with federal law relating to rebate programs, as well as related to Medicaid, and insurance costs for Medicaid aren't going to increase due to the setting of an upper payment limit. So just some of those guardrails to protect Medicaid expenditures with upper payment limits. And then down after line 20, there's a number of certain federal entities and programs that are being excluded from the application of upper payment limits. And both of these amendments on this page were adopted in the House version of the bill that moved. And finally, on page 11, we have some technical corrections to the dates. There's no September 31st, so that should be September 30th. And down on the December 31st, it changed to September 30th to align the 2 dates. So that's all that's happening there.
Did you, I'm sorry, did you say, did you read those amended? Second for this bill is amended. Senator Kramer, Senator Giles, Senator Kramer, all in favor of the amended bill 357.
I think Senator Reedy
Senator
has a
Reedy,
question.
before we take a vote.
Well, I just was curious, there was a talk at one point about making sure we dealt with drugs, drugs for high risk.
The rare disease and oncology. drugs are
It's in there?
Mm-hmm.
Okay, thank you, I just confirmed it, thank you.
And Amber, you did an amazing job on that bill. It was a lot of work, thank you. All right, so I have a motion and a second. All in favor of Senate Bill 357 as amended? Okay, I think we need to call the roll.
Senate Bill 357 with amendment. Vice Chair Hayes.
Yeah.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy. No. No. Senator Mounts.
No.
No. Senator Jackson.
Yes.
Yes. Senator Washington. Yes. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey. No. Madam Chair.
Yes,
Yes. 7-3, the bill passes.
thank you. Okay. We have another Senator Hershey bill.
And the,
Move unfavorable.
okay, Senate Bill 844 requires a self-service storage facility operator to provide an occupant a notice that includes certain information prior to conducting a lien sale of personal property. Specifically, at least 10 days before conducting a sale of personal property authorized under the Maryland Self-Storage Act, the operator must notify the occupant of the time, place, and terms of the sale by hand delivery, verified mail, or electronic mail at the occupant's last known address. If an operator notifies the occupant via email and does not receive a response at least 5 days before the sale, the operator must then promptly send a second notice to the occupant by verified mail to the last known postal address. There is no fiscal impact
No amendments
and no opposition.
Does it do anything?
It's
clarifying from last year.
correct.
Something that was.
And there were comments, I believe, at the bill signing that the governor made, so this is kind of closing some of that.
Another one the governor asked me to do for him, so I said, okay.
Could I just be asked to be added as a co-sponsor?
What?
Okay.
All right.
All in I need a motion on Senate Bill 844, not,
As amended.
okay.
As
So we have
amended.
Senator Lamb and Senator Guile, all in favor of Senate Bill 844 with no amendments
Hershey Land Bill.
other than sponsor amendment. All right, unanimous vote. All right, and once again, I love this, we have two withdrawals, so I need a motion unfavorable withdrawn for Senate Bill 831 and Senate Bill 969. Can I have a motion? Senator Washington and Senator Reedy. All in favor of motion unfavorable? Unanimous vote, thank you. Thank you all, have a good evening.